Good morning. This will be a narrated presentation for the 7.2 assignment for Justice 510 Contemporary Criminal Justice Issues and Trends by Ryan Huffman, Tiffin University. Date's going to be October the 10th, 2024. The issue addressed will be police officer health, addressing the mental health crisis here in the United States. As a fellow police officer, we take an oath of office when starting our first day of work. The oath, on my honor, I will never betray my integrity, my character, or trust in the public. I will treat all individuals with the dignity and respect and ensure that my actions are dedicated to ensuring the safety of my community and the preservation of human life. I will always have the courage to hold myself and others accountable for our actions. I will always maintain the highest ethical standards and uphold the values of my community and the agency I serve. As we continue through this presentation, I want to focus on line 3 there, which is highlighted in blue. I will always have the courage to hold myself accountable and others accountable for their actions. This becomes important throughout this presentation. Most events in which cause citizens in the United States to call the police are traumatic to them in some form or fashion. The police officer who responds to this generally traumatic scene or time of need in which a civilian is called faces this on a daily basis, often only seeing the negatives in society. The buildup of traumatic situations through the officer's career on a daily basis can have a buildup of negative emotions and lead to complications with their mental and physical health. Law enforcement has been labeled as having the highest risk of suicide over any other profession in the United States. In fact, rates of officers who die by suicide are more than triple of that who are fatally injured in the line of duty, according to Hilliard. For better understanding, the law enforcement career has been labeled as having the highest risk of suicide over any other profession in the United States. In fact, officers who died by suicide are more than triple the rates of officers who are fatally injured while working in the line of duty, according to Hilliard. The law enforcement career has been labeled as having the highest risk of suicide over any other profession in the United States. According to Hilliard, rates of officers who died by suicide are more than triple of that who were fatally injured while working in the line of duty. Some key factors that can contribute to this would be the police officer's code of silence, which limits police officers from reporting a fellow officer who feel they may be struggling in a time of need, and also the stigmas associated with asking for help. According to a Hilliard study in 2019, for a better understanding of suicide rates amongst police officers, they compared 100,000 U.S. citizens compared to 100,000 U.S. police officers. In the study, they found that 13 out of every 100,000 citizens committed suicide, whereas 17 out of every 100,000 police officers also committed suicide. The study further found that cities such as Chicago and New York have declared mental health crises due to officer suicides. New York declared one after losing 9 police officers to suicide. In Chicago, a force of 13,000 officers had a suicide rate higher than 60% than the national average. Many police officers have a stigma associated with the idea of reporting mental health issues. The stigmas can come from them feeling weak or incompetent, or feeling that their fellow employees may see them as weak or incompetent if they ask for help. Another stigma associated would be the label of them being unfit for duty. Many police officers have to take a psychological test prior to being hired. If they are found not competent enough for the job during the psychological testing, they would not be hired. Thus, the officer learns that if they are not able to pass such tests, they could be fired from their job. They also believe in asking for help, being seen weak or possibly unfit for the job. They could be altered from the career path that they wish to proceed with during their career. With the stigmas associated with asking for help, officers are generally led to self-medication in forms of alcohol or drugs. The code of silence within law enforcement officers often prevents officers from intervening and informing managers of the police department that the officer is in trouble. A Hilliard report found a study in the New York Police Department found that of the 89 officers that committed suicide, 72% of them had alcohol in their system at the time of their suicide. We are learning that we must educate our employees on the mental health eligibility that they have for assistance. In a study completed by Padilla in 2022 of a 134 member Southwestern department, they found that 34% of the officers knew that the department provided services for stress or mental health, while in that same pool, 38% of that same body were unaware of any services or how they could benefit from them, reporting that only 60% of the officers supported the idea or participation in mental health or stress relief services. This information shows that the department has failed to provide employees with the educational services and benefits that the mental health programs that their department has could do for them. A call for action was made in 2017 when the Law Enforcement Mental Health and Wellness Act was established. It pushed for programming of officers to receive mental health assistance, in-house psychological services, resiliency training, peer support, chaplains, employee assistance programs. A case study of the Bend Police Department in Oregon, due to the COPS program. The Bend Police Department had a population of about 94,000 citizens, with the average citizen population being over 90% white. The police department indicated in the early 2000s, when the study was, that they had saw a significant rise in civilian mental health calls for service. Thus, this prompted them to act for their officers. Initially, Bend PD allowed their officers to work out 1 hour per week while on duty to complete physical training, and they increased verbal focus on mental health. Throughout the program, it changed. Officers began working on team building exercises, whole body and holistic health ideas, peer support programs, spousal support programs, an on-site psychologist who completed ride-alongs with the officers and spoke to them about the benefits of mental health. And the chief also changed the shifts to 11.25 hours a day, in which an officer only worked 3 days a week, thus freeing up the officers' time and allowing them more time to participate in mental health services. The top-down approach by the Bend Police Department is what is needed. By the changing of shifts, it allowed officers more time to participate in services, showed leadership had a commitment to the idea. They allowed shift sergeants to lead mindfulness programs daily for officers who wished to participate. They placed apps on officers' phone for mental health services and participation. And they reported that they believed that they had a 75% participation rate by officers within the program. Chief Porter was quoted as saying, "We expect officers to perform like athletes physically. We expect their minds to be sharp like doctors in stressful situations, and we work them ridiculous hours. If we want officers to be effective and efficient in their jobs, we must support their wellness holistically." An ARPA grant was received in 2021 at the hands of Governor DeWine in the state of Ohio. It was rewarded to Marietta Police Department and the Marietta Fire Department in an excess of $127,000. The services were to provide mental health service and a wellness app to the officers' phones. What Marietta PD did is officers were mandated to attend one appointment per year with a mental health provider, and it was a 2-year program. Officers could attend up to 10 times per year. The grant covered the cost of the appointments with the provider and also covered the officers' wages while they attended. Officers were allowed to attend on duty or as overtime in their off time. Marietta PD assumed the same top-down approach as Bend PD did, by the chief and captains attending the same appointments first. It showed the officers that they were taking the same approach. As officers began to go to meetings, they began to talk openly with one another about going. Officers began to speak openly about their spouses going to the same mental health counseling with them. And officers began to speak openly about any medications that they were prescribed to help them with their anxieties related to the police department. We believe that the code of silence and stigmas were fractured with receiving mental health help. And during the same period, we had one officer in a very bad situation that we felt could have ended badly, and were able to send him through an employee assistant program and mandate him into the help, which turned the officer's career around positively. In the end, the 2-year grant ended. Without the funding that we had to stop the program. Now we must think of ways to be smart and continue in cheaper ways. According to Reed, physical activity implications can reach a positive, significant effect on mental health and social well-being. Focusing on that, we have allowed officers to begin working out on duty, provided them time to do that. We can see benefits in reduced sick time and decreased officer injuries in said time. A focus has to be made on outside sources which are free to us. The Washington County Sheriff's Office is directly across our alley from us. They have a chaplain program and have many of them on duty at a time. Their program calls a chaplain to all death scenes and offers them to the public, and also supports the officer during the incident. They also have a very active peer support program and have allowed us to reach out to them for help. In the end, I think more funding is needed. The funding needs to come from the state of Ohio or the federal government to continue programs that we once had. Continue support from the public officials to address the crisis is needed. Locally, from my department, we have to be smart with the funds we have. We have to keep increasing officers' activity levels, maintain a top-down approach on the ideas, and remember that education and kindness are always free.